Welcome to our presentation on mental health issues for older adults. This presentation is for any older adult who's experiencing depression or loneliness that is affecting them from living their day-to-day life, or for anyone who wants to learn more about depression in older adults. I will start off with a few facts and terms and then go over a type of therapy and its techniques that might be beneficial. After that, Andy will be discussing more about loneliness in older people and what that might look like and how it might get treated. People who are 65 and older are defined as older people. So 34 million Americans aged 65 and older suffer from some form of depression. Older adults are at an increased risk for experiencing depression. Approximately 68% of adults aged 65 and older know little or almost nothing about depression. Retirement can lead to a loss of identity, status, self-confidence, and financial security, which can lead to the risk of depression. There might be a few signs to look out for if you or someone you know is experiencing depression. Some behavioral definitions of depression, and like I said, things to look out for is one is mood, so persistent feeling of sadness, anxiety, or feeling emptiness. Interest, lots of interest in activities that were once enjoyable. Another one is sleep, so difficulty sleeping, waking up too early or oversleeping. Another one is suicide, so thoughts of death or suicide, or maybe attempting. A few more, cognitive change, having trouble concentrating, remembering details, or making decisions. Appetite changes, eating more or less than usual, or experiencing weight loss or gain. And last is impulsivity, engaging in high-risk activities such as alcohol or drugs more than maybe one would normally do it. Depression is a very real and treatable medical condition, but it is not a normal part of aging. There are types of therapies that have been known to be successful and helpful in treating depression in older people. One type of therapy used is called acceptance and commitment therapy. ACT is the third wave of mindfulness-based cognitive behavioral therapy. Over time, it has accumulated a huge scientific evidence base supporting its effectiveness, and it was created by Stephen C. Hayes. ACT is based on a model of 6 core processes called the Hexaflex. On this slide is a picture of it. Usually, ACT sessions typically include 6 stages of discussion: acceptance, cognitive diffusion, being present, self as context, values, and commitment to action. ACT sessions can help older people put things more into perspective by encouraging them to focus on what's important in life and not, rather than having negative thoughts about their future and what's going on. ACT helps with health problems as well and mental health issues such as anxiety, obsessive compulsive disorder, and psychosis, and many other ones. If you've tried a lot of things to feel better and you've tried to change your life and you're still struggling, ACT might be for you. The overall goal of ACT is to overcome avoidance by using behavioral and mindfulness change techniques. Here on this slide are a few techniques of ACT. So one technique is coming up with coping strategies. So this would include like mindfulness techniques such as meditation or breathing exercises. Another one is validating experiences. So this can support positive aging by validating older people's experiences and reactions and just accepting losses that can't be changed. Another one is clarifying values. So in the early sessions of ACT, it focuses on assisting older people to clarify their values and what matters most to them. Then after doing that, they can connect their values and apply them to their daily lives. Last one is awareness that control is the problem. This can help older people recognize that controlling their thoughts and feelings may worsen them. And ACT overall uses metaphors to de escalate or calm the thoughts from stressful or from overwhelming thoughts and feelings. There are a lot of benefits of using ACT. As I said before, it is scientifically supported, and there have been a lot of research and studies done that have shown that it has been successful and it has worked. Another benefit is that it really helps patients that are struggling with mental health issues not turn to medication. So ACT teaches people how to change the way that they're feeling and thinking without needing to use medication. And people that are doing ACT, the patients might not be able to eliminate all the medication, but if it does work, they might be able to reduce the medication or maybe not be on it altogether.
Loneliness is a major cause of depression in older adults. By adapting an ACT-based approach, symptoms of depression in the elderly can be reduced. We'll start with the behavioral definitions of loneliness. First, not surprisingly, is lonely. The person feels isolated and lacks structure to their activities for daily living. Next, particularly important for older adults, is struggling with the feelings of being alone after the death of a loved one. Also, of particular note in older people is empty nest. It can be difficult to adjust to an empty nest after the children have left home and a new life stage has to begin. Next is avoidance. This is when a fear-based anxiety or feelings prevent them from making attempts to build relationships and broaden their social circle. Next, low self-esteem creates strong feelings of inadequacy. This makes it hard for the person to put themselves out there and establish social contact. They begin making distance between their family members and coworkers and neighbors. This leads to them eventually feeling alienated from virtually all their extended family. And they also live alone, and they tend to rarely leave the house except for in moments when they absolutely need something to sustain their life, like food or something like that. These feelings of loneliness can eventually lead to risky dating, where the person uses the internet to date without appropriate caution and can get themselves into bad situations. And eventually, their lack of social contact leads to mistrust, where they have a hard time trusting anyone. There are 5 long-term goals for treating loneliness. The first is to reduce the overall frequency and intensity of loneliness. Next is to reduce the level of isolation while increasing social engagement. Third is to resolve the core fear that prevents social outreach. Fourth is to become more engaged with social contact through community involvement. And last, build a structured schedule into the daily routine that includes meals, sleeping, exercise, and out-of-home activities. Now for treating loneliness, you want to start with cooperation. You want to establish rapport with your client and strengthen powerful relationship factors such as working collaboratively, agreeing upon goals and expectations. You need to demonstrate consistent empathy, verbalize positive regard and affirmation, and collect client feedback. And next, you'll want to have your clients describe their experiences of loneliness and explore the results of social isolation. Then you want to assess whether the client has a fear-based avoidance of such social contact, such as agoraphobia, and assess if their withdrawal is due to an underlying depression or anxiety disorder, and then you want to treat these specific problems with evidence-based approaches. You'll want to run some psychological tests to assess the nature and severity of their social anxiety and avoidance. You'll also want to have a complete medical evaluation to figure out how much a medical condition or substance abuse problem could relate to their social anxiety and avoidance. You'll also want to get an evaluation with a psychiatrist to see what kind of medication could be helpful in their situation. You'll want to gather information to assess the client's level of insight into their disorder. You also want to assess them for evidence of correlated disorders such as ADHD, and also assess how much age plays a role in their problem behavior. And finally, you'll want to assess the severity of their impairment. And you'll want to identify causes, ask the client to identify possible reasons for their social network deficits. You'll want to educate the client on new coping skills like relaxation skills, cognitive techniques, and conversation techniques. And then you'll want to verbalize with your client why the treatment that you're providing is going to be the best course of action. Next, you'll want to implement some of the calming and coping strategies that they've learned, and also teach them how to replace and challenge their fearful talk with more realistic, positive self-talk. And another important aspect of this treatment is exposure. You'll want to gradually introduce them into more social situations that they're fearful about, spending more time out and being around other people. Next, you'll want your client to engage in pleasant social activities on a daily basis. This is a continuation of the exposure. You'll want them to learn and implement personal and interpersonal skills to reduce their anxiety. This will help them build a new social network. And then also, very important, especially for older adults, they need to learn to accept their limitations, because there are some things that can't really change as you get older, and acceptance of those can make life a little bit easier. Next, you'll want your client to identify their feelings that are associated with their distrust of others and that has led to their avoidance of socialization. You'll want them to acknowledge that this belief about others being threatening is based more on their subjective interpretation and rather than objective data. You'll want to explore how their past experiences were a source of low self-esteem and social anxiety, and how they play a current role. Next, you want your client to work through developmental conflicts that took place in the past, maybe their childhood even, that play a role in influencing their current struggles. You'll want them to describe verbally how their defense mechanisms allow them to avoid close relationships. And it's important to maintain involvement with their family and friends and social activities. Next, you'll want them to establish a consistent sleep schedule, and also create and implement a schedule of daily living activities to keep their life active. And you'll want them to share their how the death of a loved one could have effects on how they feel. And finally, identify positive traits for the client to help keep them motivated.